going to go a little more into depth on epithelial tissue shapes and kind of relate those shapes back to their function, right? So for epithelial tissues, we have three different shapes. The first shape kind of looks like a fried egg. Also, all the cells are going to have this kind of more fried egg shape. We call these squamous. The second type is they're going to look like a square, okay? And what's kind of important is that they have this very centralized nucleus. And we refer to these as cuboidal. And then we have a nice, more elongated cell with a nucleus. It's not always truly as centralized as cuboidal, but still usually it's pretty close to the center. And we have columnar. A feature you might find on columnar as well is you may find on the top these little finger projections, otherwise known as microvilli. So micro for small, villi for fingers. There are microvilli that you can find on some cuboidal, but this is not nearly as common. These three shapes can then comprise a full tissue, and so because the epithelial tissue is just cells, and so you may have a tissue, right, where you have lots and lots of fried eggs, so that's a squamous tissue, or lots of cubes, and so that's a cuboidal tissue, and then there's columnar, lots of those columns, and that's a columnar tissue. We can separate this into two ways. So the first way is simple. Okay. So the simple is one layer. So we'll draw one layer of cuboidal. So we've got a lot of cubes. Remember, there's just cells in epithelial tissue. So I've got all my cuboidal lined up. Remember, at the bottom, we always have a basement membrane. Right? And so this tissue, if it's simple, right, if something's coming at it, right, it's not going to do a very good job of blocking it from coming. However, it can, because it is a cell and cells have their selective permeability, it can decide what can and what cannot go through the tissue, right? So we can have some ability to regulate what's going through the tissue. We can also regulate what's going out of the tissue, okay? But it's not going to be doing the main barrier function. If you're thinking about some like physical protection, it can do a little bit of friction resistance, but it's mostly going to be regulating what's going in and what's going out. The other way that we can organize our tissues is going to be what we call stratified. In stratified tissues, instead of one layer, we have many layers. So I'm just going to draw a glob here of squamous cells. So lots and lots of squamous tissue, right? And just imagine that there's many, many nuclei here. And of course, we still have our basement membrane. Now, if something is trying to get in, it has many, many, many layers of cells to get through, so it's not going to be able to get through this layer. So we're going to be more of a barrier here. So it's going to be more of a wall that protects the tissue from anything getting in or out of it. So when you're looking at these tissues, remember to think about, okay, what shape is it? Is it squishy like a squamous cell? Is it bulky like a cuboidal cell? Or is it long and elongated like a columnar cell? And then think, okay, if I put it together, is it going to be this simple and we're regulating what's going in and what's going out? Or are we going through a barrier? And those together will help us understand what's the function of this tissue overall.